Okay, well, good morning, everyone, and thanks for joining me again today for our second session of our three-part regulatory education series. So last week we covered regulation and what were all the components of regulation, and so today we're going to be talking about the entry-level competencies for licensed practical nurses. My name's Kathy Arsenault, and I'm the practice consultant for the Association of New Brunswick Licensed Practical Nurses. Before we get started, I am just going to review the format of the webinar, as we do have some new folks joining us today who weren't on the webinar last week. So I just wish to inform you that this session is being recorded and it will be uploaded to our website for others to watch at any time. So if you know some colleagues who would benefit from watching this or they weren't able to join us today, you'll be able to share that with them. Your microphones will remain muted throughout the presentation, but if you do have questions or comments, I'll ask that you just type them into the Q&A box located on your screen. And all of those questions will be answered at the end of the presentation. If you are having any difficulty hearing me, just try to adjust your audio settings, and you can find this on the bottom left-hand corner of your screen if you just hover your mouse in that area. So I thought that this would be a good topic for us to cover because I think there are probably a lot of people who don't even really realize that we have these competencies, because the first competencies were only established in 2013, so just 7 years ago. So if you graduated prior to 2013, such as myself, this document was not in existence. And so the document's recently been revised just last year in 2019, and you can find the publication on our website at www.anblpn.ca. And it is now a pan-Canadian document, which means that it applies to all LPNs across Canada. So I'm going to start this presentation by talking about what exactly is entry-level competencies, what's a little bit of the history of those competencies, and hopefully provide you with an understanding as to why we have them and why this document was revised. From there, we're going to review some of the more specific changes that were made for the new document, and then of course we can end with some question and answer. So what do we mean by entry-level competencies? Entry-level competencies really are what describe what's expected of all LPNs across Canada in terms of the competencies that they possess. So as I said, this is a pan-Canadian document, so it pertains to all LPNs across Canada. And when we're talking about entry-level LPNs, it means those who've just graduated from an approved practical nursing program and have received their initial licensure and registration. But it still applies to those of us who are not new graduates as well, that we're going to talk more about. These competencies really serve to help describe the knowledge, skill, judgment, and attitude that is required of entry-level LPNs in order for these LPNs to provide safe, competent, and ethical nursing care. They also serve to inform LPNs and the public what are the minimal expectations of LPNs, and to bring some awareness to LPNs as to what their professional obligations are. So as I said, even if you're not an entry-level practitioner, you still have to adhere to your entry-level competencies, because that is what is expected of you. And as you advance through your career, you of course are going to be expanding your knowledge, you're going to be expanding your competence, which is all part of our CCP requirements. That type of learning and professional growth isn't reflected in this document. It is solely based on those entry-level competencies. So the creation of this document was made possible through that provincial collaboration with CCPNR. So for those who might not be aware of the organization or what that acronym means, it does stand for the Canadian Council for Practical Nurse Regulators, and they were first formed in 2004. CCPNR is a federation of provincial and territorial members, and they're legislated with the responsibility for ensuring safety of the public through the regulation of practical nursing. And what they do is they provide a forum for provincial collaboration among all Canadian LPN regulators, and their mandate is to promote excellence in practical nursing. And they've also expanded to collaborate on different pan-Canadian documents, such as this one that we're talking about today, for regulation purposes. And that's included collaborating with other healthcare professionals as well, like your registered nurses and your registered psychiatric nurses. So what we're going to talk about next and just touch on is just a bit of history and development of how these competencies even came to be. So back in 2012, the Canadian Council for Practical Nurse Regulators, they recognized that there was a need to state and describe the competencies that were expected of entry-level LPNs across Canada. So as a result of that, the first competency document was released back in 2013. And at that time, it was called the Entry to Practice Competencies for LPNs. So some of you might be aware of that first version that was released in 2013. So the 2013 version was adopted by just 7 of the Canadian jurisdictions, and New Brunswick was one of them. And the 2013 document was applicable only to those Canadian provinces and territories that adopted them. So it was not yet a pan-Canadian document like it is today. And the competencies, again, they help describe that knowledge, skill, judgment, and attitude required of entry-level LPNs in order for them to provide safe, competent, and ethical care that we strive for. And so then in 2018, CCPNR began work on revising the competencies, and that stemmed from evidence-based data, and it was with the intention that all jurisdictions across Canada would adopt these competencies. So from there, a task force was created, and they had representatives from all jurisdictions who license and regulate LPNs across Canada, and the task force is who really led the revision of this project. And one of the goals of that revision was to have all those jurisdictions adopt the document to achieve that pan-Canadian competencies for all LPNs. And so, of course, we're happy to report that that was successfully achieved. All of the revisions and competencies that were made stemmed from that evidence-based data. And there was definitely some major drivers that brought on these revisions, and these were based on the types of complaints that jurisdictions were receiving about LPNs. And these complaints really, it included issues with, issues with professionalism, documentation, confidentiality and privacy, particularly in regards to social media, which we know is a huge issue right now. Medication errors, LPNs having a lack of responsibility and accountability, failure of an LPN to recognize gaps in their own competence, and at times even practicing without a license. And so sadly, these are all issues that New Brunswick has experienced as well. And so as our profession has grown over the last few years and we see more responsibility and leadership roles for LPNs, it definitely was time to address those issues and revamp the competencies to include areas like professionalism and leadership and what is expected of LPNs in these areas. So during the creation of the document, there were focus groups that were created, and those included LPN educators, supervisor, and new graduates, and they participated in these focus groups. They were asked to share their views on what kind of changes in the profession had occurred over the last 5 years, and based on those changes, what type of modifications would they like to see happen as a result of those changes. So there was a lot of valuable feedback from these focus groups that contributed to the creation and the revision of this document. So once the revised document was completed, it did receive validation from the LPN community and key stakeholders, and it was approved by the CCPNR Board of Directors, which brings us to where we are today with the finalized project. So now that we know the history, we can talk a little about what purpose do these ELCs fill, and then I'll speak directly to the revisions that were made. So our entry-level competencies, they are used by stakeholders, regulators, and employers for a variety of different reasons. So one of the main reasons they're used is to help develop that exam blueprint, curriculum development, standards, and assessments. So for practical nursing programs to be recognized and approved, their curriculum obviously needs to meet those entry-level competencies to make sure that everybody is graduating with those entry-level competencies. And so that's a component of accreditation when the colleges are accredited for their program. We also use them for practice consultations, competency assessments, and professional conduct reviews. So, for example, if we get a complaint about an LPN's practice and it comes into question, we can use these competencies to assess whether the LPN is meeting those entry-level competencies, or we can help identify where they might be falling short. Or also, if we have nursing professionals coming from other countries, we can also use these to assess their skills as part of their transfer process to Canada. And they also serve as a resource for employers and the public so that we can help promote an awareness of LPNs, the expectations of entry-level LPNs. So it does help employers verify what is within their scope and what the expectations are of each LPN on staff. So there's several listed assumptions that you'll see in the new document, and they were agreed upon in terms of LPNs and the entry-level competencies. So I'm not going to sit here and list them all for you, but I just wanted to bring forth a few of the main ones for you here that we're going to highlight. So for one, we can all assume that LPNs possess competencies that are transferable across all areas of responsibility. So this includes direct care, education, administration, basically any practice environment. We can also agree that LPNs are active participants in health promotion, illness prevention, and harm reduction activities. It's assumed that LPNs practice in any setting or circumstance where healthcare is delivered. So there are no practice environments that are off limits to LPNs. And this next one is an area that we see more focus on throughout the entire document, and that is that LPNs demonstrate leadership by fostering continuous self-growth so that we can better meet the challenges of our evolving healthcare system. LPNs, of course, are following the nursing process in order to deliver safe, competent, and ethical care. And LPNs advocate for the implementation of evidence-informed practice. So we can start talking now about some of the actual revisions that were made. So again, I'm not going to go through every single revision that was done, but I'm going to highlight the main ones for you. So one thing for you to note is that even though this is a revision, it does not require any upgrading or retraining for LPNs, because I know that anytime something new comes out, we worry that we're going to have to do more training or more education. But that's not necessary in terms of our entry-level competencies. Rather, it's just serving as a kind of a reminder of what the expectations of LPNs are and bring some awareness to your own professional obligations as a licensed self-regulated professional. One of the first changes you may have noticed is that there's been a title change. So it was previously known as Entry to Practice Competencies. Now it's titled Entry Level Competencies. So that change was made because it was felt that the title was more appropriate and reflective of what's expected of an LPN, whether they're actively practicing or not. Another change that you're going to notice is that the wording used in this new document, it's very much less task orientated, and the focus is more on that big picture of nursing, not task lists that were used in the past. And it focuses more on collaboration among the healthcare team as well. And the revisions also reflect the amount of growth that has occurred for LPNs over the years, which has been pretty big. So the competencies are really organized into 5 different categories, and there's 76 competencies in total within those 5 categories. So the 5 categories that it's broken down into are professional practice, legal practice, ethical practice, your foundations of practice, and your collaborative practice. And all of those areas have been revitalized so that it has that greater lens on professionalism and leadership. So I'm going to touch on each of these 5 categories briefly to talk a bit about some of those changes that were made in each category. So the first category we're looking at is professional practice. And as I said before, you're going to notice that the wording that's used, it's less task orientated. It focuses on that big picture of nursing. So it uses verbiage like demonstrates, initiates, maintains. You're also going to notice that there's an increased emphasis on fitness to practice, professionalism, using your critical thinking skills, and continuous learning. So this is where our CCP comes into play because it is part of our standards of practice and our code of ethics. And it does point to adhering to your regulatory requirements, which are your practice hours, registering on time, and participating in the CCP. One of the major changes in this section is making that distinction between a regulatory body, an association, and a union. And that's a major area of misunderstanding from our own members. And if you joined our first webinar last week, we did talk at length about what regulation is and how it differs from other organizations such as a union. And I just want to reiterate here that while we are talking about professional practice, I just want to remind you that that professional practice includes social media as well. So, if you do have questions about ANBLPN's role, please just ask us directly rather than kind of going directly to the airwaves and you start posting inaccurate information. So certainly if we want to be seen as the professionals that we are, we need to be professional across all of those communication mediums. So the next category is our ethical practice. So this section does remain focused on advocacy, professional boundaries, and diversity, but there was also 3 major areas of expansion in terms of ethical practice. So the first one is the inclusion of the calls to action of the Truth and Reconciliation Commission of Canada. So this was not part of the 2013 version. And when you read through those competencies, it is competency number 24 that states that LPNs will obtain knowledge and respond to the calls to action of the Truth and Reconciliation Commission of Canada. The second major area of expansion is again leadership. So it encompasses more on leadership qualities with an increased references to advocacy and taking action. And then finally, we see a much greater emphasis on diversity and advocacy for equitable access. So there's many references to respecting diversity, advocating for equitable access to healthcare, and advocating on behalf of clients who cannot advocate for themselves. And then our third category is legal practice. So again, you're going to see subtle changes with using different wording, and this area is more condensed than it was previously. It does point to confidentiality and the importance of maintaining confidentiality across all personal and professional contexts. So again, it encompasses social media, which we know is a major area of concern. And the documentation has become a bit more condensed as well, so that it's encompassing all aspects of documentation rather than chopping it up into various statements. Our fourth category is foundations of practice. So a major area of emphasis here is the development of the care plan. And it speaks to the fact that LPNs are involved in the development of the care plan through collaborating on the care plan with the healthcare team. So somewhere along the line, it seemed that there was a thought out there that LPNs don't do care planning. That's simply not true. LPNs are definitely involved in care planning, and we collaborate with the healthcare team throughout that care planning process. There's an emphasis on clinical judgment, critical thinking, and critical inquiry. And it really does speak to the importance of professionalism in social media. So again, it's in regards to the appropriate use of social media, because this is where we mostly see unprofessionalism. And then our fifth and last category is collaborative practice. So we again are just seeing more of a focus on collaboration and leadership throughout this section, as well as, the inclusion of advocating for Indigenous health knowledge and healing practices. You're also going to see that there's also a definite increased focus on leadership, both formal and informal, as a major expectation of all LPNs. So this does speak to the fact that more and more we are seeing LPNs in leadership roles and that they are working more autonomously. So we have LPNs who are working in management positions, as instructors, as owners of businesses, and traditionally we would not have seen LPNs in these roles, but it's definitely becoming more commonplace as our profession has been evolving over the years. So as we start to wrap up today, I just wanted to point out the glossary in this document because it is quite valuable, and the amount of work that was put into the glossary was really equal to the amount of work put into the entire document. And that glossary is really just further showing the changes in the terminology that was used in the document with the use of those increased verb action words. So I certainly do encourage all LPNs to review those entry-level competencies. And as I said, you can find that document on our website. It is a very valuable document, and that revision has really, it helps show the amount of growth that has occurred in the profession, and it helps promote the increased autonomy of LPNs as well. So I do want to thank you all for joining me today to discuss these ELCs. I'm of course happy to stay on the line and answer some questions at the end. You can use the chat box. I do hope to see some of you again for our third and final presentation next week on scope of practice. So that's on September 29th at 1:30. And so what I'll do now, obviously my contact information is on there if you're not sticking around for the Q&A, but I'm just going to stop our recording right now so that we can do our Q&A. So if you have questions or comments, certainly just type them into the box.